8 immediate steps to arrest nosebleeding. Nosebleeding demands immediate action geared towards its arrest. The causes of nosebleeding are multiple, but a lot can be done at home. Nosebleed is commonly from the front of the nose, called the Little's area. The area has a lot of blood vessels which help to normalize the air entering our body. Occasionally, it could be from the back of the nose, but this is more common in the elderly. Nosebleed could be very scary, but it is rarely fatal. Most of nosebleeds could be managed at home. Follow the steps described below, and in most cases, the bleeding will stop. 1. Put the person in a sitting position. Put the person in a sitting position with the head tilted slightly forward to prevent blood from running down the throat. 2. Tilt the head slightly forward. Bleeding, especially from the back of the nose, can go into our stomach, and that will cause vomiting or into our airway, and that could affect our already compromised breathing. Tilting the head slightly forward will prevent this. 3. Loosen any clothing around the neck. Anyone bleeding from the nose is already frightened, uncomfortable, and the airway is moderately blocked. Loosening anything around his neck will help in no small way. 4. The nose should be blown. The nose should be blown to expel any blood clot. Ask the person to breathe through the mouth. 5. Pinch the nostrils between the second finger and the thumb. The nostrils are then firmly pinched between the second finger and the thumb continuously for about 10 minutes, particularly near the tip of the nose. 6. If bleeding continues, an ice bag should be applied. If bleeding continues, an ice bag should be applied to the bridge of the nose. If bleeding still continues, medical attention should be urgent. 7. See a doctor. Very often, actions 1 to 6 will stop nose bleeding in children, and except in case of injuries, you do not need to see a doctor. However, an adult must seek medical advice to exclude any diseases. Moreover, should the person become unconscious, put him in a semi-prone position with the face turned forward while waiting for medical attention. 8. Cauterization. Repeated nosebleed, especially in children, usually benefits from cauterization of the blood vessels in the Little's area of the nose. This is done in most cases by an ENT surgeon under general anesthesia. In conclusion, nosebleeding can happen occasionally, and it's usually not serious. With these steps, it can be managed. If it becomes frequent, heavy, or difficult to stop, it is important to seek a medical attention.